Welcome to today's Explainer. We're diving right into the hidden secrets of thyroid medication. For a lot of folks, managing this daily pill feels like an endless puzzle, especially when literally all you want to do is just drink your morning coffee. But instead of just staring at lifeless numbers on a lab report, we're going to discover the actual mechanics of what happens inside your body and see how tiny, seemingly insignificant details make a massive difference.
So, why does a tiny pill stand between you and your morning coffee? Let's start with that highly relatable question that probably pops up every single morning. Picture this. You've just woken up, your eyes are barely open, and your absolute only hope in life is to sip that first cup of coffee to wake up. But then, boom, you remember your thyroid pill. It's standing there like a brick wall. Why does this one specific, tiny pill ruin the simple joy of an early morning brew? Well, it turns out it's not just some annoying medical suggestion. There's a highly precise chemical reaction that kicks off the exact second that pill drops into your stomach.
Here is our roadmap for today. We're going to crack the morning dose puzzle, look at the Chemical Clumps Trap, explore the 8 weeks rule, completely debunk the illusion of normal range, and finally, look into the cancer survival shield. Stick around because this is going to change how you look at your daily routine.
All right, let's jump right into part 1, the morning dose puzzle.
The standard routine for this medication is honestly pretty brutal. You have to wait a full 30 to 60 minutes before eating breakfast or having that coffee. You essentially have to put your entire life on pause. But this agonizing wait isn't just a random rule. Think of this tiny pill as a demanding VIP celebrity who absolutely needs an empty room. It requires total isolation inside an empty stomach just to dissolve safely. And water is the only acceptable transport. Using literally anything else instantly breaks the golden rule and disrupts the pill's path to your bloodstream.
Which brings us to part 2, the Chemical Clumps Trap. Let's look at the biological why behind that strict empty stomach rule. I found this concept of metal magnets absolutely fascinating. See, if you take your thyroid pill and immediately follow it up with a breakfast packed with calcium, or maybe an iron or multivitamin supplement, those elements don't just politely pass by the medication. No way. They act like powerful, aggressive magnets. They literally attach themselves to the thyroid medication molecules right there in your stomach, completely altering the shape and structure of the drug.
And the consequence of that trap is pretty wild. Mixing the medication with those metal magnets creates an absolute disaster for absorption. It results in what we call chemical clumps. These are massive, clunky molecular formations. Because they're suddenly so large, they just get trapped. They literally bounce right off the walls of your intestines and exit your body completely unabsorbed. The medication never even makes it into your blood. The tragic result here is that you might feel constantly exhausted even though you're strictly taking your daily dose, all because the drug simply passed right through you.
So how do we escape this chemical trap and actually reclaim our mornings? Enter an absolutely brilliant biological workaround, the Dawn solution. Here's how it works. Step 1. You fast for 3 to 4 hours after dinner to make sure your digestive tract is completely clear. Step 2. Take the pill right at the crack of dawn after fasting through the night with just a full glass of water. And Step 3. Simply go back to sleep. By the time you wake up at your normal hour, you're officially in the safe zone. You can freely enjoy your coffee and breakfast without a second thought because the drug's molecules already had a clear, safe path into your bloodstream.
Moving on to part 3, the 8 weeks rule.
Let's zoom out a bit. We're also used to regular painkillers, right? You pop a pill and boom, immediate chemical relief. Your headache vanishes almost instantly. But thyroid medication operates on an entirely different biological timeline. It relies on a slow, steady biological build in the bloodstream. So if your doctor changes your dosage and you still feel tired a few days later, it absolutely does not mean the new dose is wrong. Unlike a headache pill, your immediate feelings have very little to do with the actual hormone levels stabilizing in your blood.
And that brings us to the magic number 8. You have to wait a full 8 weeks for the hormone to truly stabilize before testing your TSH levels again. If you rush it and test in week 1 or 2, you might see some minor shifts, but the final picture is totally blurry and incredibly misleading. 8 weeks is the mandatory waiting period to give your doctor an accurate snapshot. When it comes to dosage changes, patience is literally the key to successful treatment.
Next up, part 4, the illusion of normal range. So many lab reports just print a standard generic range, usually something like 0.45 to 4.5, and people think, hey, if I fall anywhere in there, I'm perfectly treated. But blindly relying on these generic numbers leaves so many folks suffering from fatigue without knowing why. It turns out, treatment is actually a highly tailored suit, not a one-size-fits-all t-shirt. Just look at the vast differences here. For healthy youth, doctors aim for a much tighter target, between 0.5 and 2.5, to restore full energy. During the early months of pregnancy, the rules become incredibly strict. The TSH must stay under 2.5 to make sure the baby develops safely. But check out the elderly profile. That target can safely go all the way up to 6.0.
Now you might be wondering, why on earth do we let the target for patients over 70 go up to 6.0? Well, artificially forcing a low TSH by bumping up the medication dosage in an older patient creates severe, dangerous stress on the heart. TSH naturally rises with age, and doctors actually accept this higher number because they prioritize the true safety of the patient's heart over trying to achieve some perfect textbook number.
Finally, let's look at Part 5, the Cancer Survival Shield.
This is where reading a TSH test completely flips. In cases of cancer recovery, TSH is no longer viewed as just a harmless metric of thyroid activity. It's actually treated as fuel. Biological fuel that could potentially feed and grow any microscopic hiding cancer cells. Because of this, doctors completely shift their strategy. They adopt an aggressive, defensive playbook, intentionally driving the TSH number down to essentially starve any potential cancer cells of the fuel they need to return.
And doctors calculate this exact starvation strategy based on the severity of the cancer history. For high-risk patients, they'll force the TSH down incredibly low, like under 0.1, creating a maximum defensive shield. This ultra-low number isn't a medical error, it is highly intentional. However, for low or moderate risk patients, the target is kept slightly higher, between 0.1 and 0.5, to balance safety. So you might ask, why not just suppress everyone to 0 just to be completely safe?
Well, because this protective shield comes with a heavy, long-term tax on the body. Extreme hormone suppression severely increases the risk of osteoporosis, which weakens the bones, and it raises the potential for dangerous heart arrhythmias. This is where the true brilliance of your doctor comes in. It requires them to balance perfectly on a tightrope, providing just enough suppression to starve the cancer, while preserving the survivor's long-term bone and heart health.
So what does this all mean? It brings us to a final, powerful question. Are we treating a piece of paper or a human body? True medical success, whether that's hacking your dawn routine or tailoring complex cancer shields, never comes from just satisfying a standard lab report. It comes from tailoring the treatment to your specific life, age, and body. Understanding the mechanics of what you're putting into your system really is the ultimate foundation of your health. Thanks for joining us for this explainer, and we hope you learned something amazing today.